Hello, my name is Andrew Respicio, and this is Challenges for EHR Adoption. This is for HCM 570 Healthcare Information Systems at Colorado State University, the Global Campus, Professor Shelley Safian on September 29th, 2019. So to start off, according to the Office of the National Coordinator of Health Information Technology, as of 2017, nearly 86% of office-based physicians had adopted an EHR, and nearly 80% had adopted a certified EHR. Since 2008, office-based physician adoption of any EHR has more than doubled from 42% to 86%. Nonetheless, implementation and adoption of EHRs are not without its barriers and challenges. Let's look at healthcare legislation designed for reimbursing providers who successfully demonstrate value over volume in patient care. This is the Meaningful Use and MACRA, Medicare Access and CHIP Reauthorization Act of 2015. It wants meaningful use for healthcare to improve healthcare quality and patient safety and reduce healthcare disparities. They want to engage patients and their families in their healthcare and become more patient-centered. It improves patient care coordination, it improves public and population health, and it is secure personal health information. Looking back at the old EHR legacy systems, they became outdated because of the age of these older EHR systems. They were time-consuming, and documentation actually impeded workflow. There's poor integration, and monitoring alerts for medical coding weren't as good. And they didn't have mobile access as they do now, as with smartphones and tablets. EHR capabilities, basically, they store and collect all the patient data electronically, replacing the antiquated system of paper charts, which could easily be lost or also could be unable for other physicians or clinicians to understand. It also supplies information to providers upon request in real time. It allows physicians to enter orders directly into a computer physician order entry system. And it also provides healthcare professionals with support tools. For example, an alert for a doctor who is going to administer penicillin to a patient due to an infection may get an alert that the patient actually is allergic to penicillin. That would avert a patient error or medical error. So adoption barriers for EHRs. Number one, cost of purchasing an EHR system, including maintenance costs and updates. Number two, resistance to change. Many physicians were resistant, thinking that it would impede their workflow process. EHR usability and training. It was tough for some people to understand because of their computer skills. They had different type of computer training. And then interoperability. And with interoperability is the sharing and exchange of information across different offices within the system, as well as within hospital systems. Recommendations for costs, government subsidies, Medicare and Medicaid, EHR incentive programs, long-term cost benefit analysis or return of investment forecasts would help with the cost, and develop a realistic EHR system budget that you would understand that it would need upgrades and it would need more add-ons as the system grew. Recommendations for resistance to change is to identify where the problem and the resistance are, involve everyone involved in the staff, as far as physicians, staff, and everyone who's involved in patient care, reinforce the benefits of an EHR system, readdress what is needed and to improve healthcare outcomes, and listen to all of the concerns from, again, everyone involved in the care process. Recommendations for EHR usability and training. EHR systems should be designed specifically and develop a curriculum. Sometimes the training needs to be tailor-made to find out what level, again, the users are with computers and technology and their comfortability as far as how they can access and use a computer. And as far as recommendations for interoperability, an EHR system should be selected based on the future of interoperability, data sharing through party add-ons or other technology. And that, again, leads back to costs. In conclusion, EHRs are transforming healthcare with a collaborative approach to patient-centered care. EHRs exchange health information electronically to improve quality and provide a safer care model for patients.